really have to work together. And when I say that, it requires the centers where the point of sale occurs. It's going to require CDPHE, who maintains the patient registry database. It's going to require the Department of Revenue, who maintains the licensees and those kind of things. We all have to work together. Law enforcement is a critical piece of this as well. But kind of what our vision is, and as an example, if you're a caregiver, you do not have the ability, if you have the benefit of a caregiver, you do not have the ability to designate a center as your primary center, meaning they don't have the ability to grow. So if a patient designates you, they meet the criteria of the center as its primary center, and you stick plants in the ground for them, what prevents them from 2 weeks, 6 weeks, 10 weeks down the road going to your competitor and saying, I want you to be my primary center? And if they do and they stick plants in the ground, then all of you are in violation because we've got more than 6 plants per patient, right? So we need to put some protections in place, and it's this web-based protocol that we envision really to provide that tool. Each of the centers having an access code, so we'll know who's in the system. Each of your employees that have access to it will know who's in there and what they've done. We can count keystrokes, those kind of things. But we should probably engage in discussions at some point about the patients and their ability to designate primary centers X number of times per year, perhaps 4 times a year, commensurate with the length of the grow, so that when plants are put in the ground, that they can stay there with that primary center until the product is harvested, cultivated, and so forth. Not to say that they shouldn't have access to medicine from any other center. I would never prevent that. Patient access is a critical component. I get that. But how do we create a system that provides protection so that you don't put yourself in jeopardy by planning those plans? And the only way we can think of to do it is through a web-based system. And what's envisioned is the patient comes to you, says, hi, how are you? I want you to be my primary center, or I want to buy meds, whatever the case may be. They produce their patient registry card, valid ID, whatnot. You have the ability to go into the system, punch in patient number 1, 2, 3, 4, 5. The system will tell you if that patient is attached to another center as a primary center. That should be your first red flag that, no, you shouldn't put plants in the ground. If by the same token they're eligible, then you will report that opportunity, you can do it. If they go to the center down the street 2 weeks later, perhaps they get meds $10 an eighth cheaper, whatever it is, and they want them to be their primary center. When that center punches it up as a condition of that sale, they're going to say, well, wait a minute, you just named this place down the street as your center, and unfortunately I can't put plants in the ground for you until those have been uprooted. And so, just an example of a protection that's going to be put in place. Likewise, if patient 1, 2, 3, 4, 5 buys meds in Colorado Springs, Denver, and Pueblo at 12 o'clock noon, from a regulatory standpoint, it's probably a problem with patient card number 1, 2, 3, 4, 5. Are there going to be fraudulent cards out there? This industry. Liquor industry, driver's license. We've never seen those people. It happens all the time, all right? And so we've got to put some protections in place, and we're going to solicit the cooperation of the industry to help us. Again, this is all about level playing field and putting some protections in place.